Botulinum toxin, better known by one of its trademark names, Botox, began as a medical discovery, but has since become one of beauty's most precise tools. With me is Dr. Maureen Allem, founder of Skin Renewal, and she's going to tell us everything we need to know about Botox.
So great to be here chatting about my favorite treatment.
What exactly is in Botox?
Botox is a purified protein which goes through many manufacturing processes to make it completely safe. We had a lecture about a year ago from actually the CEO from AbbVie. He came into South Africa, and it was fascinating how he explains what goes into manufacturing botulinum. That's why it is so important to only use registered products and not grey products. So when you go to your aesthetic practitioner, make sure you look at the bottle to see exactly what you're getting, because there are only 3 botulinums that are registered in South Africa: Botox, then you get Dysport, and then you get Xeomin. So that is so important, because otherwise you don't know what you're getting. And you may lift your brows, but you may drop your health. So important.
How did you become such an expert on botulinum?
I've been doing this for now 25 years. I was fortunate enough to have my first botulinum treatment in the year 2000. And when I saw how it affected and what it made me look like and what it made my sisters look like, just that relaxed expression, I realized that this was going to be a winner. And this was the aha moment in my life, And it started me researching it, going overseas to get the best injector to train me, and we are talking about the year 2001. And ever since then, I've been changing the way we inject to know exactly where to inject to get the best results. It's all about the depth of the botulinum, exactly where you place it to get that, that lifted brow expression, to get a bright eye expression around the eyes, and to lift the jowls as you go on.
For me, it's very important to go to someone with a lot of experience. I mean, you have, 25 years experience, and you must have seen thousands of patients.
Absolutely.
And Botox, as we know it, we only used it for the frown back in the day, or around the eyes. Now you can use it for proportions and harmony on all of your face.
No, absolutely. So if you have a very square face, you can inject it into these muscles here, your chewing muscles, grinding muscles, and that relaxes over 3-4 weeks. You cannot believe how you get this beautiful oval face, and you don't look, people think you've lost weight because you've relaxed those muscles and you've changed the shape of your face. You can inject it around the jawline to get it, to lift the jowls up, because you relax the muscle that pulls everything down.
And that makes such a big difference. I recently went to Skin Renewal. You call it the Nefertiti lift.
Nefertiti lift.
Yeah, into the neck.
Yeah, those are the platysmal bands. And why you do that is because with time, that muscle becomes very hyperactive. And it's a very thin sheath of muscle that attaches from your mouth all the way down to your clavicle. And because it's hyperactive, it starts cracking up. It makes tiny little tears in the muscle, and it shortens. So by shortening, it's pulling the whole jaw down. So by relaxing that muscle and starting sooner than later, so one way you can see whether you need to start is you gently say E. And if these muscles are moving, you need to know that you need to relax.
I have very strong muscles here in my neck. And I also found that it helped, with a little bit of a double chin, and it pulls your chin back.
Absolutely, because you're relaxing it and everything's going up. So these are depressors. So by relaxing the muscles, they go up. On the forehead, you have depressors. So by relaxing muscles, it goes up. And that's how you get the brow lift in certain areas.
Now, did I also hear that it's good for antidepressive?
Yeah, they did a clinical trial, and my cousin, who's a psychiatrist in London, he was very, skeptical about this botulinum. He sent me the article, and he said, I can't believe that it actually helps depression, because it modulates the emotional response in your limbic system, the area that processes emotions. So it's quite incredible what it does. And maybe that's why you feel so much better once you've had your botulinum. And another thing is when you look in the mirror and you look good, you also feel good.
And doctor, so many years of research later, they've now discovered there's so many other things you can use botulinum for. Migraines, excessive sweat, what else?
Oh, so it's incredible. So migraine, because it relaxes those muscles that cause the tension headache. And then another thing, I think it's a neuropeptide that works in the brain to help for migraines. Then you can do it along the jawline too, where you have, big jaws.
With your clenching?
Yes, if you clench, you've got a very square face, you can reshape your face. If you perspire a lot, we can give it in your underarms and other areas, believe it or not.
Gummy smile.
Where it stops that excessive sweating. We can give it around the lips, just a tiny little bit where you can stop the pursing of the lips. Well, not stop it, but relaxing. You don't purse as much. So if you purse your lips and you see that you actually go white and you make a lot of wrinkles, over time you will start developing those lines above the lip. And then very often people smile and all their gums show. So what we do is just a tiny little bit of botulinum in strategic points, and that just gently lowers that top lip. And when you smile, you just see normal teeth. You don't see the gums.
And for hair loss?
So anything that increases circulation to the scalp is going to improve hair loss. So by injecting botulinum into the scalp, you're actually relaxing those muscles of the hair that, tighten the scalp. So by increasing circulation to the scalp, you're going to stimulate those follicles because it's getting more blood supply. And then another interesting fact when I learned at one of the anti-aging congresses is that it increases the anti-aging microRNAs in the skin. And those are the ones that are anti-aging. So we have a treatment where you do skin needling and you make thousands of entry points in your face and your neck. And then at the end of the treatment, we just gently apply a little bit of, 10 to 20 units of botulinum, which seeps in, and you cannot believe how your skin starts to glow.
Unbelievable. Now, I started, I think, in my late 20s, just before my 30s. I'm now
perfect
44.
Age to start.
Perfect age to start. And I find I have to use very little because
you train your muscles.
Preventative.
Yeah, absolutely.
So that is a good age to start when you start seeing, there's one or two lines forming because of my frown permanently. Is that a good time to start?
No, it's an excellent time to start. And, very often for patients, they come in for botulinum because they know they want to have anti-aging effects. And that's exactly where we can start explaining to them. So when you come into Skin Renewal, it's not about lying on the bed getting your botulinum. No, it's a perfect opportunity to explain to patients the 7 sins of aging skin. And that we take you through that. We ask you about your concerns. We ask you about your dreams. We explain the 7 sins of aging skin. And people are totally unaware of most of them, so that they can have better skin down the line, because it's just one of the pillars of anti-aging, botulinum and injectables. The next pillar would be in-clinic treatments to improve the integrity of your skin and skin health. The next one would be medical-grade topicals to actually maintain the results you're getting from your botulinum and your in-clinic treatments. And then obviously lifestyle. And just a few little tips and pointers and dropping seeds of knowledge is what we do. And then patients can take that knowledge and then go and research it for themselves. Because I'm a big proponent of being an advocate for your own health. You have to know what's going on in your own body, and don't just, pass it off to someone else to tell you what to do. There's so much information out there.
Educate yourself, read, learn.
Absolutely.
Make sure you speak to the experienced experts.
No, yeah.
Baby Botox.
Baby Botox.
Big trend?
Yeah, some of the patients don't want to inject a lot. When I explain to them, I can give you exactly the same points, but the dose is going to be half or a third. So instead of doing 4 units, you do 1 or 2 units. So you'll get the effect, but it won't last as long. And some people are very happy with that.
But some women can take a lot of Botox, and some can take a little. So again, it's a very individual thing.
Yes, so you don't really know at the time. So you inject the botulinum, and then they must come back 2 weeks later so you can see exactly, where you've injected, whether they're having a little bit of a quirk of an eyebrow, because that muscle's stronger there, and then you can touch it up, and then we take notes. So we know the next time, we know exactly where to inject the botulinum. And that's why when some of my patients, most of them have been coming in for more than 20 years, so I know exactly how to inject them.
And how long does it last, generally?
So it lasts depending on the dose. So if you do baby Botox, 6 weeks, 2 months. If you give the proper dose, like 4 months, and we normally remind you to come back. And then we have two peptides that we can give you that actually prolongs the effect of Botox. So one is in our A-chain peptides, and then an even stronger one, the amplified one, is in our age-defying cream, and that can make your Botox last 6 to 8 weeks longer. That together with zinc. Zinc is so important.
One of your doctors taught me this at Skin Renewal,
Yes,
is that I need to drink zinc to make my Botox last longer.
So zinc is the spark plug to make that connection work. So your minerals are the spark plugs for every enzyme reaction in your body. That's why it's so important to take zinc, magnesium, to have all these minerals, selenium, molybdenum, and all these minerals are the spark plugs for your enzyme processes.
And then lastly, Dr. Maureen, should I be sleeping on my back so that I can save my face and not get wrinkled? Not?
Not. No, I know, like when I go to these congresses and I hear the dermatologist telling a group of 5,000 doctors to tell their patients to sleep on their back. They haven't got sleep apnea. They don't know what sleep apnea does to a body. Because when you lie on your back, gravity pushes your whole throat back. And it closes that little entry place at the end. And when you go into deep sleep, that's your restorative sleep where your growth hormone kicks in. Everything happens in deep sleep. Your whole body relaxes. And then if you've got gravity to add to that, you're going to stop breathing for 10 seconds or more. The tongue falls back and blocks the airway. And you can imagine what that does to the body. You can drop your saturations to 70. You have no idea. And then you get a jolt of adrenaline, and then you wake up, and then you breathe again. That's the way the body saves you. But it puts you into this fight or flight mode, which is not great because it causes many things. So go look it up. Just go look up, And so I tell my patients, do not sleep in the back. We can always fix what's happening here, but
getting good sleep is more important.
Yes, the health concerns are more important.
And then what do you have to say to someone that is still scared to try Botox?
Come in, you don't have to have botulinum. So come in, we'll explain to you what other things we can do. It's not only about botulinum, that's only one of the pillars of anti-aging. And I can see it on my patients who only want botulinum. They don't want, or maybe even dermal fillers. They don't want anything else. By the time they get 20 years later, you can see it on their skin. Their skin health isn't as great as someone who's, taken the whole journey and gone through the whole journey and improved the skin health. It's a huge difference.
And what are some of the myths around botulinum?
That you're going to get a frozen face. You only get a frozen face if you do it so it's the wrong depth, too much botulinum, and then you cannot move a muscle. And nobody wants that. So previously, from the States, they said you have to do 20 to 25 units per area. And it's not like that anymore. You need a little bit of emotion. Emotion of your face, little bit of emotion in your face. So it's all nuance. That's so important.
And making sure you go to the experts.
Absolutely, and make sure you're getting the right, the right botulinum, the registered botulinum, because it is, it can cause problems down the line if you don't.
Use the wrong one. Thank you, Doctor.
Pleasure.
I have been so blown away with my experience coming to Skin Renewal, the in-clinic experience.
It's so great.
I've learned so much from you, and I can't wait to be back.
Thank you. I love to impart my knowledge and make my doc, try and get them to a level where they know so much and they can help patients.
Thank you, Doctor.
Thanks, Cindy.
Botulinum toxin has had so many years of research and has advanced so far beyond just being used for frowns and lines. It now really is something that can even help with your hair loss or with lifestyle concerns like clenching your teeth. So remember to educate yourself, use the right products, speak to the right experts, and even if you just want to start with a bit of baby Botox, you want to prevent rather than just cure.